Hello everyone, I am Dr. Kartikeya Bhargava and I am Senior Director Cardiac Electrophysiology and Pacing at Medanta the Medicity Gurugram. So SCA or sudden cardiac arrest is a situation where the heart stops functioning, it doesn't pump the blood, and once the blood does not reach the brain, the patient collapses, and if it is not promptly treated, the patient dies, and that we call it as SCD or sudden cardiac death. And sudden cardiac arrest and sudden cardiac death can happen to anyone at any time, and whether the person is poor or rich, whether male or female, doesn't matter. It can happen in the morning, it can happen in the evening, or it can happen while the person is at rest or while the person is exercising. So it can strike anybody at any time, and whether irrespective of the patient's underlying heart condition or not. There are certain conditions of the heart which increase the risk of SCA, and the most common of which in the adults is coronary artery disease and prior heart attack. Now, if a person has coronary artery disease or has had a prior heart attack and lower heart functioning, then the risk of SCA or sudden cardiac arrest is quite high. And these are the patients who are deemed to have high risk of SCA and sudden cardiac death. There are certain other conditions which can also predispose to sudden cardiac arrest, and one of those is ongoing heart attack or ongoing myocardial infarction itself. You may have heard that someone who was absolutely fine a moment before has chest pain, collapses and dies, and that is basically because patient started to have heart attack, and this heart attack resulted in abnormal heart rhythm, resulted in sudden cardiac arrest and finally sudden cardiac death. There are other situations which can also lead to sudden cardiac arrest, and some of those are the heart muscle diseases. Sometimes the heart muscle can get very large, one we call this as dilated cardiomyopathy. There may be certain situation where the right lower chamber of the heart fat infiltration instead of the muscular fibers, and that can also lead to arrhythmias or lead to sudden cardiac arrest. And there are other situations, sometimes genetic situations, where the heart muscle may be actually much more thicker than normal, and this can also result in arrhythmias and sudden cardiac arrest. Apart from these, there can be other certain genetic conditions where the heart is structurally normal but predisposed to certain arrhythmias which can result in sudden cardiac arrest, and these manifest in small children or adolescents, but sometimes can manifest first time in adults as well.